Hello, and welcome to this week's episode of NHIS in a Week. Here, we give you happenings and insights of the authority and the scheme. My name is Bridget Apia. Now the headlines. NHIA chief rallies CPC staff to end illegal charges and advance Mahama care. NHIA deputy CEO of finance visits Central Region. NHIA to roll out cashless system by year's end. Now to our first story. NHIA Chief Executive Dr. Victor Asari Bampo met staff of the Claims Processing Center in Accra last week. The visit formed part of his drive to end illegal charges and build support for the government's health vision.
On Monday, August 11, Dr. Bampo sat with CPC staff in Accra to listen to their concerns and share his vision for the authority. Discussions touched on co-payment, fraudulent claims, and welfare issues affecting staff. He praised their dedication and assured them of reforms, including a human resource audit, a staff credit union, and fairer access to training.
I keep telling people that I've worked all over the world, but coming to work at NHIA is a revelation for me. Look, you are the best cadre of human resources that I've worked with around the world.
Dr. Bampo stressed that eliminating illegal charges was key to restoring public trust in the NHIS and achieving universal health coverage.
The real reason why we're here is looking at eliminating what you said, co-payments, fraudulent claims, tightening the controls around which we work. And you are a very key part of that.
Backed by his deputies, he warned against collusion, noting that sanctions will be applied when necessary. Staff appreciated his inclusive leadership and presented him with chocolates and a citation in recognition of his compassionate style.
Moving on, the acting Deputy Chief Executive of Finance extended her working visits to the Central Region last week. She met with regional and district teams to strengthen financial management systems.
In Elmina, Ms. Anatu Anseidu Bogobiri engaged regional and CPC directors, accountants, and district managers from the Central, Greater Accra, and Western regions. She emphasized the need for open dialogue and praised staff for their dedication to improving financial discipline. Ms. Bogobiri highlighted the successful nationwide rollout of GiftMiss and announced plans to introduce a cashless system across all offices by the end of the year.
We should know that the art of genuine progress lies with open dialogue. Okay? This kind of dialogue creates a space for honest conversation and collaborative thinking. And by doing this, we will build a culture of trust, transparency, and accountability, which is an essential foundation for an institution such as ours.
She also revealed that training would soon begin on a new financial manual to standardize operations and enhance accountability. Staff were encouraged to strengthen financial reporting to support NHI's mandate.
The NHIA joined the nation in mourning the tragic loss of 8 national leaders in the helicopter crash. The authority pledged lifelong healthcare support for their families.
At the state funeral at the Black Star Square, Dr. Bampo led a delegation including executive management and senior staff to honor the departed. He laid a wreath on behalf of the authority and assured the widows and children of lifetime NHI's coverage to ease their burden.
I think at this point, led by the president, the whole nation is coming together to honor them and to make sure they are not forgotten. So in that spirit, we also decided together as an executive and staff of the NHIA to make sure that the widows and the children of the 8 heroes would have coverage for the National Health Insurance Scheme in perpetuity. What happens with the scheme is that every year one has to renew it. But we've done the back end work and we've put the algorithm in place so that so long as they hold the cards, they will not have to renew it. Now remember also that under the direction of His Excellency the President, we're bringing on board the Ghana Medical Care Trust, which is the Bahama Cares, which is for non-communicable diseases. And very soon we'll also be rolling out the free primary health care. So it's going to be end-to-end health coverage from free primary health care through the National Health Insurance Scheme, which covers 95% of all diseases, to the Bahama Cares, which is also looking at non-communicable diseases. And we are going to make sure that they are covered.
Dr. Bampo described the gesture as a way of honoring their sacrifices while advancing NHI's mission of protecting the vulnerable. He also underscored the authorities' role in upcoming initiatives such as free primary healthcare and Bahama Cares, which will expand coverage to non-communicable diseases.
The NHIA Chief Executive has sent a caution to health providers who continue to charge illegal fees and has vowed to revoke the credentials of facilities caught exploiting NHIA members.
In an interview with Onia TV, Dr. Victor Asari Bampo condemned illegal payments as unfair and unacceptable. He revealed that since assuming office, the authority had paid about 1.6 billion cedis in claims, made possible through the government's decision to uncap the health insurance fund. With timely payments now in place, he said there's no justification for illegal charges.
We're a human institution and we work with humans, so there are always challenges. So this is one of the biggest things that we're trying to fight against, because it's not supposed to be so. But we're clothed with all the powers to make sure that when health facilities do that, we have some things that we can resort to make sure that it doesn't happen again. We are going to make examples of some of these facilities which do that.
He revealed that in his regional tours. He witnessed the positive impact of the scheme on pregnant women, children, and the elderly. He therefore stressed that management remain committed to protecting the integrity of the NHIs.
When you have health and you have no need for the card, there are lots of things you can say. My executives, my staff, and I will go around the country. In fact, I've been to 9 regions. By the end of the year, we hope that we would have done all 16 regions. And when we go, we actually see the benefits of the card. For pregnant women, for the elderly, for children who are ill, they actually use the cards because it takes a huge financial burden away from them, and it's in fulfillment of the President's vision of universal health coverage, which is actually getting health at the point of need without financial burden.
He assured the public that strict enforcement and timely claim settlement would sustain confidence in the scheme.
On to our last story. The NHIA announced plans to fully go cashless by December 2025. The move aims to boost transparency and reduce risk at district offices.
Acting Deputy CEO of Finance and Investment, Ms. Anatu Anseidu Bogobiri, confirmed the decision during her meeting in Elmina with regional and district teams. She explained that the system had already been piloted in 4 districts, including Weja and New Joabin South, and will be scaled up nationwide by year's end.
The cashless system is being piloted in 4 of our district offices, and these offices are Gan, Amasaman, La, Satellite, Weja, and New Joabin South. And it's a strategy to mitigate the risk, associated with cash collections. On completing the pilot phase, the solution will roll out nationwide across, all the districts.
The cashless system will route all NHI's payments through Ghana.gov, reducing manual handling and financial leakages. She also disclosed that staff will soon be trained on new financial manual to replace the 2008 edition, which will unify operations across the authority. Ms. Bogobiri urged staff to embrace the reforms and affirmed that it would make the NHIA more transparent, efficient, and accountable.
Jimmy Ruffle, I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This brings us to the end of this week's episode of NHIS in a Week. For more stories, log on to our website on www.nhia.gov.gh and do visit our social media platforms displayed on the screen. Thank you for watching.